So it's perfect timing now. Thanks for having me on. My dog, of course, is barking because someone is parked out front and the sun is totally in my face. But we're going to go with this, and I'm going to share my screen. So hopefully you'll all be able to see this in a moment. Great. Can folks hear me and see that all right, the screen?
Yes, we can see it.
Great. All right, terrific. Well, I'm very excited to chat with you all today and talk a little bit about lead exposure in Michigan and the various things that both we can do as in our own state and to frame some of the things about the problem in Michigan. So, sorry, 1 second here. All right, I think we have that under control now. Anyway, as I was saying, so thank you, Mara, for the introduction, and we will get back on track now that the work at home dog barking is done. So what I want to start out with is talk a little bit about the legacy that lead has in many of our lives here in the state of Michigan and indeed across the country. And I'm going to cover a few things, and then Elin Betanzo is going to dig in later to talk a little bit more about lead in water. And then Paul Haan and perhaps some of his folks at the Healthy Homes Coalition of West Michigan will talk more about the work that's being done there. So what I want to do is give you an overview of the problem. So first of all, many of us, especially those that are health professionals, are familiar with lead's toxic legacy in paint. In the United States, it was banned in 1978, which is after some other countries had done so. But we know that in states like Michigan, we have a high burden of lead paint in homes that were built before 1978 and that have lead paint on them. The problem with that is with an older housing structure in our state, we have a tendency for homes to have paint that is on the windows or doors or other frictive surfaces or surfaces that get a lot of wear and tear that may break down and turn into lead paint dust. So something that we're really concerned about here in the state of Michigan. Another source of lead that folks may or may not be familiar with is lead in gasoline. Again, it began a phase out in the early 1970s, but really hadn't been completely banned from cars until 1996. It's important to know that lead in gasoline or lead in airplane gasoline is actually still allowed in the United States. And so at a lot of your smaller municipal airports, you may still have leaded gasoline in many of the planes that are there. This is different than thinking about, the Detroit airport here in Michigan and jet fuel and things like that. This is going to be for your smaller planes. So that still is allowed. And what we have as a result of that is quite a bit of contaminated soil along roadways and things along those lines. Soil contamination is not only coming from lead in gasoline, it may be coming from lead in paint as well. For example, if you have around the drip line of a home where you may have lead paint on the outside of the home that is broken down, you're likely to have lead exposure in soil that way. From industrial sources as well, and things along those lines can lead to lead in soil, which has been thought to be one of the very important routes of exposure. Now we've learned more about lead in water, and so I want to briefly go through that and then have Elin talk a bit more. So in the wake of the Flint water crisis, we learned that many of our pipes in lead service lines in our homes had a history of contamination with lead. And again, as I mentioned, Elin is going to go over more of this, so I'll briefly cover on it, that the Safe Drinking Water Act in 1986 did ban using new lead service lines, solder, flux. But by ban or lead-free, it's important to note that plumbing materials still are allowed to contain lead, and I'm sure Elin will talk a little bit more about that. And it wasn't actually until 2014 that brass fixtures and faucets were required to be what's called quote-unquote lead-free. So we have this problem, this legacy of contaminated infrastructure and our water infrastructure as well, from older lead pipes and service lines, solder, flux, brass fixtures, and so on. Another area that you might have someone be exposed to lead, maybe through less commonly known things like lead that contaminated food or spices, consumer products, cosmetics, alternative medicine, tackle, so fishing tackle or ammunitions, and things along those lines. So folks might have heard in the last few years that they have found lead in a number of different spices, for example, like turmeric and things along those lines. And then we're looking to figure out a little bit more about where that contamination will come from or where it is coming from. Folks are probably familiar with a number of the recalls on lead in children's products and children's toys in particular that flooded the news in around 2007. Ecology Center was involved with some of the testing of those products and so on. And while this is a smaller proportion of the exposure, it actually can have really detrimental impacts on a child, for example, that is exposed through one of these different alternative pathways that's less common. So why are we concerned about lead? Well, we know that it's a neurotoxicant, which means that it has an impact on our brains and our nervous systems generally. For children in particular, we're concerned about children who are exposed either through consumption of lead behavior, if it's lead in paint or lead in soil, lead in dust, through actual consumption of lead contaminated water. That's an important exposure route for those products. And obviously, as we think about children who may be mouthing things in their own environment, like toys or jewelry or something like that, you may have exposure that way. On the neurotoxicity side, or the brain harm side of things, lead has been linked to a large decrease, 4 to 7 points decrease in IQ for every 10 micrograms per deciliter in blood lead levels. Right now, the action level for lead in the US set by the CDC is 5 micrograms per deciliter. And that number is set with the proportion of children who will have an elevated blood lead level. So that number will go down over time, which is good. And it means that there are more children that we need to address at lower and lower levels because there is no safe level of lead exposure. Other things lead has been linked to are hypertension, hearing loss, osteoporosis, other brain diseases like buildup can lead in Parkinson's, ADHD, and other attention disorders and things along those lines. ADHD is interesting because in the next slides, we'll see a link a little bit more with attention or juvenile delinquency or even crime and ability to habituate to situations, to control hyperactivity, to control your impulses is something that is impacted by exposure to lead. So as you can see on the slide there, over 20% of ADHD cases have been associated with an elevated blood lead level. So lead poisoning is often, in the news, and it's something that will come up and folks will see elevated blood lead levels at high rates in maybe some of our urban areas like Flint or Detroit or Grand Rapids. But it is really a statewide crisis, and occasionally we do see things bubble up in more rural communities across the state. A huge proportion of our housing stock was built before 1978. And what that means is that there may be lead paint on the walls, lead in the soil from both the paint and from any cars that have gone by, and deposits of air deposits of leaded gasoline, and the lead pipe infrastructure, lead service, brass fixture infrastructure within a home. So this data is from 2016. There has been a little bit of a slower way, it's been slow to get information from the state on the current levels of children with elevated blood lead levels. So you may see some older numbers here, and I hope to update those and give you newer numbers as soon as they become available and finalized by the state of Michigan. But in 2016, you can see that at least 5,521 children had elevated blood lead levels. And I say at least because we're only testing a small proportion of children in our state. So many more children need to be tested in order for us to really know the extent of the problem. So in some cases here, you can see that in the last bullet point from data from 2015, over 10% of 1 to 2-year-olds in certain zip codes within these communities here, Detroit, Meuninck, Grand Rapids, Adrian, and so on, had elevated blood lead levels. In some zip codes, it was even much higher than 10%. The map here can show you a little bit about where this exposure is happening. And again, remember that these are only children who have been tested. So you can see that a number of, if you look at the map there, you can see the concentrations in some of our urban areas and some of our rural areas. I'll give folks a second. And we can put I believe this is a little bit, the image is actually the 2015 data. We do have the more relevant and more recent data from 2016, which we can share with you all. This is just, again, to give you a perspective on the fact that this is a statewide problem. Every year, you're going to see different communities pop up in different orders for the top 10 counties or areas of the state that have the highest percentage of children with elevated blood lead levels. So as you can see, in 2015, we had a really high a large amount of children, percent of children with elevated blood lead levels in Lenawee County, those that were tested. And then you can see the city of Detroit. Now, for the state, they pull out the city of Detroit from the rest of Wayne County, just as you may have seen in other information and data for the state, for example, with the COVID data. Things are sometimes reported out differently. You can see Kent County there. Paul will talk about some of the work that he and his team are doing in Grand Rapids and in Kent County on the west side of the state to address blood lead levels there. And as you can see, this is at the level of 5 micrograms per deciliter, that CDC action level. So in addition to the negative impacts on a child's life, the problems they might encounter afterwards, there's a huge economic burden both to families in our and to the state taxpayers themselves because of our legacy of lead hazards in the state and then elevated blood lead levels. This is a study that we completed in 2016, and there have been different analyses in the years in between that look at the cost of lead exposure in Michigan and across the country. So here you can see that we have a number of different factors to consider in terms of children's elevated blood lead levels and the cost there. So the biggest chunk you'll see is reduced lifetime earnings. And that again comes from the neurological impacts and the loss of IQ. So as a child has an elevated blood lead level and their IQ unfortunately may drop because of that, they're less likely to earn as much money as a child that would not be exposed. You can see that's the light green for those folks who can see that. You can see the darker green, you may see adult crimes that are linked to exposures to lead and childhood. And again, that adult crime or juvenile incarceration, the dark orange, that chunk there is another large section to consider in the costs. Now, to do this analysis, the Ecology Center worked with an economist, Tracy Swinburne, and we used peer-reviewed literature and used the Michigan data in our report to draw these numbers. So we didn't just make them up, but we used analyses that had gone through peer-reviewed journals and the state's own data to come up with these numbers here. So it's a huge cost. The total cost in this 2016 report we found to be around $70 million a year. And a huge chunk of that is actually a cost to taxpayers as well as that an individual might have. So the cost to taxpayers might be the cost for associated crime and juvenile delinquency and things along those lines, treatment for lead-related ADHD, special education, and so on. So there have been a number of things that have happened in the last 6 or so years. 4 or so years, particularly in the wake of the Flint water crisis, to really double down and start to think about how do we address lead in our state. And you're going to hear from Paul, who serves alongside me and many other amazing people at the state's Child Lead Exposure Elimination Commission. And what you can see here is the roadmap that was created in 2016, which has, I believe, 109 policies about lead and how we can reduce children's lead exposure in the state of Michigan. Since then, we have worked on a number of different action plans and prioritization of those many, many policies in the map in order to come up with a shorter list of things that we would like the state to do, or we would call on the federal government to do, to reduce children's exposure to lead in the state of Michigan. From those policies, the Ecology Center, many of our different partners in a coalition called the Michigan Alliance for Lead Safe Homes have come up with a number of policy proposals that we're pushing, both in 2020 and in future legislatures. So here's a list of some of the policy proposals that we want to make sure you're familiar with a little bit, particularly those fellows who are in our Health Leaders Fellowship program. These are things that you'll be talking with lawmakers about in the candidate engagement and policy meetings that do come up, even if they're virtual, that we're going to have this year. So the first one there is universal testing for all 1 and 2-year-olds. Right now in the state of Michigan, we are trying to follow the federal mandate to test all children at 1 and 2 years old that are on Medicaid. However, what we're learning is that we miss a lot of children who may be in housing stock that is still older, but they're not on Medicaid. They may have exposure through lead-contaminated water, or they may be living in a home where, mom and dad have just done a remodel and they're going to potentially have more exposure to lead as a result of that, even if they are at a higher income level generally. The second thing there is what we really think is important to get to primary prevention. So primary prevention means stopping exposure to lead hazards before a child has an elevated blood lead level. So before a kid comes into contact. And one of the ways to do that is to require a lead inspection risk assessment or a test of various environments in the home, the soil, the paint, the water, before the sale of a home or the transfer of a lease of the property. That's incredibly important. It's a heavy lift. It'll be difficult for us to move forward, but we are encouraged that other states are beginning to introduce policies like this, and it really is something that we need to do in Michigan eventually. Some of the other policies there is shifting the burden of proof to landlords to prove that they have made their home lead safe if a child has been poisoned there, and fixing and disclosing any lead risks before renting that to families. Elin is going to talk more about funding, installing, and maintaining filtered drinking water stations in Michigan schools. It's to make sure that children in schools and daycares are protected from lead exposures there. She'll talk about that problem a little bit more and the solution, which we call Filter First. And then ensuring that we have enough funding in all of the different budgets for the Department of Health and Human Services at the state and for our local health departments to be able to do education work on how to avoid lead exposure, abatement work in homes to remove lead hazards in homes, and for the Childhood Lead Exposure Elimination Commission to be able to fund the primary prevention and innovation grants that we have been able to give out to over 24 organizations, be they nonprofits like Paul Haan's organization, Healthy Homes Coalition of West Michigan, or local public health departments, to focus again on preventing lead exposure before children come in contact with a lead hazard, and to think about ways that we can actually pilot and test universal testing of children across the state. So that's where I'm going to pause, and I think we're going to take questions at the end. Is that right, Mara?
Yep, that is correct.
Great.
Perfect. Thank you so much, Becca. And like she mentioned, we will have time for questions at the end, so please be sure to share your questions using the chat box. But with that, I'd like to introduce our second speaker for the evening, Elin Betanzo. Elin is the founder of Safe Water Engineering, LLC, a consulting firm working to improve access to safe drinking water through engineering and policy consulting. In August of 2015, Elin played a critical role in uncovering the Flint water crisis by encouraging pediatrician Dr. Mona Hanna-Attisha to conduct a study that discovered elevated lead levels in children living in Flint, Michigan. This discovery exposed the extent of lead contamination in drinking water delivered to residents of Flint. Elin continues to raise awareness of lead in drinking water and improve public health protection of safe drinking water regulation and legislation at the federal and state levels. Elin has over 15 years of drinking water experience. She worked for the Environmental Protection Agency in the Office of Groundwater and Drinking Water, developing and implementing regulations under the Safe Drinking Water Act, and serving as the National Tribal Drinking Water Coordinator. Elin holds a Master of Science in Environmental Engineering and a Water Quality Management Certificate from Virginia Tech. She also has a Bachelor of Science in Environmental Science and a Bachelor of Fine Arts in Piano Performance from Carnegie Mellon University. Elin is a professional engineer registered in Michigan, Maryland, and Virginia, and a certified water system operator in Maryland. In 2014, she was appointed to the Federal Advisory Committee on Water Information. And with that, I'm happy to turn it over to Elin for her presentation.
Okay, thank you. Let's see. All right, can you see my screen?
Yep, we're all set.
Okay, thank you very much for having me. I love talking about lead in drinking water, and I love that Becca set me up to jump straight into the water. And we've got the background of the health effects of lead. So we get to get deep into the water now. I'll use all my metaphors here. So when we talk about lead paint exposure, lead dust, we have a very highly vulnerable time with our toddlers when they're crawling on the ground and have a high hand-to-mouth activity. And that's why we do the blood testing so much at the ages of 1 to 2. And that's when the kids are crawling around and putting their hands in their mouths. And so that's where we have all of the data. But lead in water is a lifetime exposure risk because the lead in water comes from our plumbing. It comes from the pipes, fittings, and fixtures. And so when we drink water in a home that has a high amount of lead in the plumbing, we drink that for our entire life. So it's not limited to that very high risk time period that we have, especially when we're toddlers. The population that is most vulnerable to lead in drinking water is actually our pregnant women and formula-fed infants. So when you consider a formula-fed infant, if they're mixing the formula with water from a home with a lead service line, there is a risk of lead in the drinking water for every ounce of nutrition that goes into that tiny little body. And so it's very high risk, but we don't ever sample the blood of an infant. So it's because the half-life of lead in the blood is about 30 days, and most children start to introduce solid foods and they go off that formula only diet around 6 months. By the time we're sampling children between the ages of 1 and 2, you wouldn't be able to detect the lead that they would have been exposed to in drinking water at that time. So we have very much underestimated the extent of exposure to lead in water to our most vulnerable populations. And then when we consider it, there's a large population that stays in the same home for their entire life. So when we have an older population, when somebody's been living in their home with a lead service line for their entire life, they have that lifetime exposure risk of always drinking water with the lead that might be coming from their household plumbing. So it does make for an interesting range of lead exposures across time. So lead in drinking water is very different from the rest of our drinking water contaminants. We very, very rarely have lead in our source water, so we can't actually remove it at a water treatment plant. The sources of lead in water come from household plumbing and small diameter pipes. So when water is traveling through the water main coming from a water treatment plant into a community, typically those large diameter pipes have no lead in them. But when we get to small diameter pipes, the small pipes that connect that water main in the street to the house, we frequently have lead or galvanized pipe in our older homes. So as Becca said, lead service lines were prohibited in 1986. And so homes that are older than 1986 are more likely to have lead service lines. In my work in Michigan, we find that lead service lines are more common in homes built prior to 1950. They started to phase out the use of solid lead pipes around World War II, when they were needed for weapons. So I have a lead service line here. So if you're looking at the video, you can see me here. This is a lead pipe. We're actually talking about a lead pipe. And so this here, if you look at the diagram in my slide, there is a valve indicated there at the property line. That's what you see here. This is a curb stop. It's the shutoff valve that you would find in any front yard, typically around the property line. And then this has lead on both sides of this example. Galvanized pipe is also a source of lead because there is lead added into that galvanized pipe formula. And then once the water gets inside a house, there are additional sources of lead in the household plumbing. In premise plumbing, we have lead in fittings and fixtures. And so that can mean that we have lead in our faucets, in the connecting valves, and all of the connecting tubing and valves and different pieces throughout household plumbing. So this particular faucet is one from before 2014. Up until 2014, pipes, fittings, and fixtures could be labeled lead-free and have up to 8% lead by weight. That's a lot of lead for a fixture to be marked lead-free. After 2014, that definition of lead-free came down to 0.25% lead. So a more recent pipe, fitting, faucet, fixture would have much less lead content in it, but still lead-free, actually by definition, does mean that it has some lead content. We also have a source of lead in lead solder that is commonly used to connect copper pipes. And that was banned in 1986, but you can still buy it in stores for other non-potable water applications. So it's really important when you're doing plumbing work to know where it came from and what kind of solder you're using, if it's lead-free or leaded solder. So because lead in water is so different, when water is a universal solvent, when it passes through the leaded materials, it can pick up that lead and deliver it to the person drinking that water inside the home. So we have a regulation that covers lead in drinking water from the EPA. It's called the Lead and Copper Rule. Lead and copper are grouped together because this is a corrosion control rule, because we can't remove the lead at the treatment plant, but we can treat the water to make it less corrosive so that less lead dissolves into the water. So this rule that we have was finalized in 1991, and it creates corrosion control requirements for treatment at the water treatment plant. We talk about lead levels in drinking water. With the lead and copper rule, we do sampling at high-risk homes, homes with lead service lines, or homes that use lead solder. We have what we call a maximum contaminant level goal. That's the safe level of lead in drinking water, which is 0 parts per billion, because there's no safe level of lead exposure. But we have this action level called 15 parts per billion. And if a water system is doing their sampling, and if 10% of their samples collected are at 15 parts per billion or greater, then they have to take additional actions. There's no violation for having an action level exceedance. There's only a violation if you don't do the follow-up steps. So they have to do public notice, public education. They have to tell people that there is lead in the water. At the federal level, there is a requirement to start replacing lead service lines at a pace of 7% per year, and they're only required to replace lead service lines on public property. So it's essentially a requirement to do partial lead service line replacement. I'll talk a little bit about that more. But what it all comes down to is there is a lack of timely violations, and since primary prevention is what we need with lead exposure, this lead and copper rule isn't all that effective for protecting people from lead in their water, because there's no violations and no real trigger for that water system to really get down to business about protecting people until several years after they've detected elevated levels of lead and then failed to follow through on those protections. So corrosion control, we add corrosion inhibitors at the water treatment plant. And essentially what a corrosion inhibitor does is you're pumping that into the water and through the water system, and then it essentially coats the inside of the pipe with a mineral layer, which it actually binds with the lead itself. And that means it's like painting the inside of the lead pipe with a very thin layer of lead paint. And that lead paint can be very high in lead content, but it makes it much less soluble. It's not foolproof, it's not perfect, but it will greatly reduce the amount of lead that dissolves into the water. However, the problem with corrosion control is that it's like a very thin layer of lead paint on the inside of that pipe. So if you shake that pipe, if you cut that pipe, if you're driving a heavy truck down the road and it loosens that corrosion control protection inside of the pipe, then you can have little particles of lead that break into the water and you end up drinking those in the home. You can't see, smell, or taste lead in drinking water. So this is very much a problem. Even when you have particles that could lead to acute exposure of lead in the water, they're still small enough that you wouldn't be able to see them. So corrosion control is an important part of water treatment to reduce lead exposure, but it's not the silver bullet that's going to prevent exposure. So let's see, I covered that in a different slide. So in Michigan, in 2018, we revised the Michigan lead and copper rule. We know that the federal lead and copper rule allowed the Washington, D.C. lead crisis to happen. It allowed the Flint water crisis to happen, and many others, Newark, Pittsburgh, Portland, cities all over the United States. But we have strengthened the Michigan lead and copper rules. So I'm going to talk a little bit about some of those things that are new. You might be surprised that they're new, but we have here to protect us more about lead in water in the state of Michigan. So there is a new sampling protocol under the Michigan lead and copper rule. Under the federal rule, there was a requirement to sample only the first liter of water out of the tap. So here is a 1 liter bottle. This is the size of what that would look like. And so if you consider this kind of schematic of the house, that first liter would only represent water that has been sitting in your faucet, in the connecting tubing, your proximate household plumbing. None of that water is going to be the highest risk water that has been sitting in a lead service line. And so the first liter samples that we've had historically, the first liter samples that were used in DC or in Flint, they don't represent the highest risk of lead in the water and the water that people are actually drinking in their home. And so the new Michigan lead and copper rule requires now, when there is a water system that has lead service lines, they have to collect the first and the 5th liter out of the tap. And that 5th liter, if you look at the schematic, is much more likely to represent water that's been in contact with that lead service line and better represent that higher risk of lead exposure from a lead service line. So that is a very important change in the lead and copper rule. The first set of compliance data with the new sampling protocol came out last summer, and 3 times as many water systems exceeded the lead action level when you actually sampled the highest risk water. So that's what we were expecting. And so then the outcome of that is now we do better public education in those communities that now we know they have higher risk of lead in the water. Another new piece of the Michigan lead and copper rule is water systems are now required to know where lead service lines are. There had previously been no requirement. There's no requirement at the federal rule to have a lead service line inventory. So what we have in Michigan is a two-phase approach to our lead service line inventory. On January 1st of 2020, water systems were required to submit their preliminary inventory, and that was kind of a paper-based records review. But we know that a lot of water systems haven't been able to keep excellent records for the locations of their lead service lines or their service line materials at all. So this was their first step in developing that inventory. And then they have to complete a verified inventory by January 1st of 2025. And that's where they have to be able to say for every service line, this is made of lead, it's made of copper, it's made of plastic, it's made of galvanized steel. They have to know what every service line is made of, and they have to do some real hands-on verification to verify that they know that what that service line is made of. They actually have to tell people that if they have a lead service line, within 30 days of a water system confirming a lead service line or determining that they do not know the content of a service line, they have to tell people that they either have a lead or an unknown service line at their home. So if you have been wondering, how might I be able to tell if I have a lead service line, here is a diagram in my slide. So the only section of pipe that you might see inside your house that might be the same material as the buried material in your yard would be the section of pipe prior to your shutoff valve inside the house. It's usually near your water meter. So if you see here where it says the service line scratch area, it's like typically not more than 18 inches. This is the piece of pipe that you would want to check. So if it's this coppery color, if it looks kind of like a penny and has maybe some of that green tarnish on it, that would be a copper service line. If it has the bulge, if it's silver in color, but a little bit shiny, but not totally shiny. If it's soft, if you can scratch it with a screwdriver or a key, if it's easily scratched. And if it has this shape here, this bulge, it looks kind of like a snake that swallowed an egg, that is a telltale sign of a lead service line. Lead service lines are not magnetic, so if you brought a magnet, it would not stick to the lead service line. So that is how you can tell a lead service line. If the pipe is magnetic, if the magnet does stick, then that would be a galvanized steel service line. So there's still some lead risk from that galvanized steel service line, but not as much as with the solid lead service line. And so what you see in your house might be different than the material that is buried in the yard that connects the water from the water main to your house. So here I have a picture of an excavation, and this is actually a picture of a partial lead service line replacement. So you can see that copper colored pipe in this picture, but if you look where it feeds into the ground, it is silver over there. That's where just a part of the lead service line had been replaced there. So it is always possible that the material underground is different than the material inside the house. But if you find a lead pipe in your house, that means you do have a lead service line. If you're in an older home that you don't see a lead pipe in the house, you still want to call up your water system and find out if they have any good records or if they need to perhaps do an inspection at your house. And visual confirmation is really the best technology we have right now for confirming lead service. The Michigan Lead and Copper Rule now bans the practice of partial lead service line replacement. And this used to be standard practice in Michigan. It is still a standard practice outside of Michigan because ownership is considered to change at the property line. And so water systems had not been replacing lead service lines that are on private property. The Michigan rule says, no, if you're going to touch a lead service line, if you're doing work on it, you have to replace the entire lead service line at once. Partial lead service line replacements increase the exposure risk because cutting that lead pipe releases lead particles into the interior of the pipe. The construction and excavation loosens that corrosion control coating. And then a new connection between the existing lead pipe and a copper pipe or other metal can create a galvanic corrosion connection, which actually increases the rate of corrosion and dissolving of lead into water. So partial lead service line replacements, while it allows a water system to work only on the portion of the pipe that they very formally own, it is a very expensive way to increase the risk of lead exposure in an individual home. So it is a big success that that practice is now banned in the state of Michigan. Michigan is the only state that requires all lead service lines to be removed within the next 20 years, full lead service line replacement. And removal, we know, is the only permanent solution to dealing with lead because corrosion control is not perfect. And the best time to remove a lead line is to remove it before you know that there is a problem. If we wait to keep monitoring the water like we do under the federal lead and copper rule, if we wait for a lead action level exceedance, that means that people have already been exposed to elevated lead in their water. We want to get those lead lines out as soon as possible. So that's where I'm gonna pause on the lead in water in general, and now I'm gonna focus specifically on lead in school drinking water. And so just like in homes, the source of lead in our school drinking water is generally within the buildings. Sources of lead in schools can include lead service lines, but it's much less frequent. Lead pipes are soft pipes, and so they pretty much have a limit of a 2-inch diameter, and most of our school buildings require a much larger service line. So it's rare that they have lead service lines, but there still can be lead service lines. They have been found. There's been many schools in Milwaukee that were found to have lead service lines. So if it's an older building, it is important to check the records, check the service lines. But they're going to be a lot less frequently. It's mostly single family homes and duplexes where we find lead service lines, but there are also some small businesses that would have lead service lines. So when we're talking about sources of lead in water, we're talking about smaller magnitude sources of lead. We're talking about that lead solder. We're talking about galvanized pipe. We're talking about plumbing materials that were not intended for drinking water use. There's no limits to the lead that can be in plumbing materials that were never intended for drinking water use. So a big one there would be lab faucets. We found very high lead in lab faucets. Hoses and spigots, sometimes when kids are training on athletic fields, they'll fill a big water cooler through a hose and a spigot, which can have high lead in them. Some hand washing sinks, fittings and fixtures that were just never intended for drinking water use can have any level of lead whatsoever. In schools, we also have the pre-1988 drinking water coolers that had lead-lined tanks. And then we've got just the plumbing materials that I described previously, that our current definition of lead-free is up to 0.25% lead by weight. And that began for plumbing materials starting in 2014. So we're talking about smaller magnitudes of lead in the plumbing, but when we are talking about schools, we're talking about a highly vulnerable population of students. But now we have leaded plumbing plus irregular water use in schools. Corrosion control, to be effective, needs to keep moving steadily through the pipes, to keep coating the pipe materials with that corrosion inhibitor. But in schools, we have weekends off, we have week-long breaks from school with no water use, we have entire summers off, we have coronavirus break off, which that's what we call it in my house. We're calling this time away from school coronavirus break. And so we're talking right now in some schools 6 months or more with no water use. So this does not give corrosion control treatment enough time to be effective, to be protective. So this kind of start-stop of flow means corrosion control is not working in schools the way it does in homes. So when we have that leaded material in the school and really long stagnation times, when we sample for lead in schools, we tend to find it. We have no requirements for sampling or drinking water safety in schools at the federal or the state level for schools that get their water from a community water system. And there have been several programs that have been recommended to do sampling, but they mostly consist of one-time samples. Lead release in drinking water is sporadic. It is not consistent. So a single sample at a single tap should not, a single non-detect sample should not be any confirmation that there's no lead risk there. It just means you didn't sample it today. If you do collect samples and you do find a high lead result, then yes, that does confirm there is a lead risk there, but a non-detect doesn't mean there's no lead risk at that home. Since we have no regulations for schools, sometimes it can be confusing when schools do their sampling and they publish their sampling results. We have these different levels of lead in drinking water that they might use as reference points. So as I said before, the lead and copper rule has an action level of 15 parts per billion. That's a measure of corrosion control effectiveness. It has nothing to do with public health protection. So that's actually a very high level of lead, and it's not protective. The bottled water standard is 5 parts per billion. The American Academy of Pediatrics recommends 1 part per billion as an action level for school. And of course, the maximum contaminant level goal is 0 parts per billion. That's the safe level of lead in drinking water. And so from this perspective, since brand new plumbing, if you installed it throughout a school, would still be adding new lead to the plumbing system, we're kind of stuck there. What do we do as schools when we've got these really high stagnation times in a highly vulnerable population? So one thing, a strategy that we've been working on here in Michigan is what we call a filter first strategy. Water filters have been proven to be very effective for reducing lead to non-detect levels, especially when we're talking about lead not from lead service lines. We're talking from those smaller magnitude sources in building plumbing. So filter stations, water bottle filling stations that you've probably seen in the airport or office buildings or maybe on college campuses can be very effective for removing lead from water. So we've been looking at this. Let's filter first. Let's not wait and sample and confirm we have a lead problem because sampling gets expensive and confusing. Let's just install filters that we know are effective for removing the lead from the water so that children can have a reliable source of safe drinking water in their school every day. And so it's important when you consider the filter strategy, it needs to be part of a comprehensive program. We can't just go and install those filter stations and walk away. Some important things to consider when we're looking at safe drinking water in schools are what other contaminants are we concerned about in addition to lead in the water? There's been some concerns about PFAS. There's also microbial growth in school drinking water. There's disinfection byproducts, a few different things to consider. If you're going to install a filter station, you have to have a plan for filter cartridge replacement because keeping a filter cartridge in that filter station for too long can create even worse water quality problems than you had when you started. So there has to be a plan before you get started. There has to be verification testing to make sure that the filters are properly installed and performing. Signage, because we, especially now in the time of coronavirus, we don't want to take hand washing sinks out of service. We want to have those filter stations as our designated drinking water points, but we want to have plenty of locations to continue washing our hands. So being very deliberate about which faucets are for hand washing and which are for drinking, that means we need to have signage and a culture change to properly implement that. Water bottles for students to use to fill up and drink water from those filter stations, transparency and communication about where those water stations are, making sure that families understand that they are to use the water stations and not the hand washing sinks for drinking water purposes. And then of course the budget and staff to support it, which is always a challenge in our education environment. So that is my conclusion of my lead in drinking water portion of events. So I'll pass it back to you now.
Great, thank you so much, Elin. And just a quick reminder for everyone to please be sure to send in your questions for the Q&A portion that we will have after our last group of speakers. So our next speaker is Paul Haan, Executive Director of the Healthy Homes Coalition of West Michigan. Paul received his BA from Calvin College, majoring in communications and philosophy. He also has a post-baccalaureate degree in secondary education with an English minor. Before working in the Healthy Homes field, Paul was a community organizer in Grand Rapids. He was appointed to the state of Michigan's Child Lead Poisoning Elimination Board by Governor Snyder in June 2016 and has been recognized for his work with Healthy Homes through various honors, including the Christine Nelson Professional Service to Children Award, Communicator of the Year, and the Governor's Hometown Health Hero. And with that, I'm turning it over to Paul.
Thanks, Mara. I'm glad I didn't wear the same shirt as in that slide right there. And I have a couple of folks that should be joining the webinar momentarily. We've asked a couple parents that we've been working with in our community to join and share a little bit of their experience. And so they may be here shortly. Just a little bit about us. We're a community-based organization that grew out of the same kind of lead data that Becca shared earlier on about kids that were affected by lead in our local community. And when we looked at that data way back in the year 2001, we realized that the prevalence of lead poisoning created bullseyes over particular neighborhoods. And we were very concerned about that. The other thing that we realized is that those neighborhoods happen to be communities of color and very low income neighborhoods. And so we saw the kind of the inherent environmental justice issue of lead. In our community then, we began mobilizing and trying to figure out what are the resources and what are the strategies that we need to employ to protect these children, to bring down that incidence of lead poisoning in those specific neighborhoods as well as across the community as a whole. So we began that work, began leveraging some federal resources into the local community, began pulling a wide variety of institutional partners together. Institutional partners everywhere from the environmental movement, our friends at Meuninck and Clean Water Action, but also our friends in housing, housing organizations like home repair services, dwelling place, other housing providers, our friends in community-based organizations, neighborhood associations, and then early childhood and healthcare, both very interested in the outcomes from lead. Healthcare, obviously worried about kids having that lead exposure and suffering the health consequences, but also early childhood because of the cognitive impairments that are the result of lead exposure. And so really began looking at different ways that we could prevent this problem, take action on this problem, change the local situation to make the situation better. Kind of watching our panelists and seeing if some of our parents are jumping in. It doesn't look like they're here yet. Hoping they're here soon, because I was relying upon them sharing a little bit about their stories and experiences. The reason why I'm eager for them to join us is that, oh, and there's Tasha. Okay, we got Tasha here, right on cue, because are really, really important. And momentarily, her parent, Chantel Ferris, may be joining us as well. And there's Chantel. You guys are right on cue. I'm going to try to unmute both of you if I can find you here. I'm not finding the two of you as panelists right now. Let me see. There, you've unmuted yourself. Thank you. So
Can you hear me now?
I got you, Tasha. So I was just giving a little bit of background on lead in Grand Rapids. And then I was just talking a little bit about how important stories about how lead has impacted people in the community are to the camp. A lot earlier on this webinar about the data, but it's really the stories and the human side of things that matters. And so I'd like to just turn it over to the two of you. You both have my name on your picture, which is really funny. But Chantel, with the t-shirt on there, if Chantel, please introduce yourself and talk a little bit about you both got them on your experiences and why you got involved with Parents for Healthy Homes.
Okay, say that one more time, Paul. It cut out on me.
your personal experiences with lead and why you got involved with Parents for a Healthy Home.
Oh, okay. Well, my personal experience with lead came about back in 2017 when I went to a WIC appointment with my daughter, and she had got tested for lead, and we found out she had tested above what are the okay levels, I guess they would say, for regulations, even though no level in my eye is okay. But she tested at about a 9. And that actually led me into seeking more help far as for my daughter's mental brain development, just trying to keep her on track. And someone had reached out to me from Healthy Homes Coalition in regards to being notified about my daughter with WIC. And they helped me out a lot when they stepped in as far as helping me do some testing in my home to find out the areas of my home that tested positive for lead, how high the lead levels were in my home. So that's what really led me to Healthy Homes Coalition. Is how I got introduced to Parents for Healthy Homes portion of that once I kind of came in and started getting educated more on lead, which is what the Parents for Healthy Homes group is about, educating, parents and families within the community about lead and basically how to avoid lead, what are some preventative measures you can put in place, some places you can seek for help, and then also just how to get involved to make some change, to get some housing codes changed to favor more of the tenants' rights versus lacing the landlord's pockets with money. So
Thanks, Chantel. And Tasha, your story goes back a little bit further. You want to just introduce yourself and say a little bit about your experience?
Yes. Yeah, mine's is a little different. So I actually had my first experience with lead back in 1997. When my son was 2 years old and he had lead exposure. We went to a WIC appointment, and his lead levels tested very high for at the WIC appointment. At that time, I did not know that that there was a Healthy Homes Coalition, or even if Parents for Healthy Homes Coalition didn't exist back then. But so I was kind of a parent who I thought was in it alone, and I was fighting the fight by myself. I went through the process with the Kent County Health Department, where they assigned me a personal nurse, came to my home, began to get paint samples. They tested the lead, their paint chips at my home, on the inside of the home, on the outside of the home, and on the garage. The lead levels tested very high. At that time, that's when they sent the landlord out the landlord really just had to reconstruct everything, the inside, the outside, in the garage to get rid of the paint. So, and moving along, I heard about Parents for Healthy Homes in the end of 2018. And I was really shocked when I heard that they no longer came to homes when children had lead levels, had tested positive for lead to remove lead. So when I found that out, then it was, I was kind of furious because they did it for me. And then I found out that there was a slew of parents who actually are fighting to get the things done that I have gotten done by myself, and that where I thought that I was in it alone. And when I tell my story, excuse me, I get quite emotional because, and my team know that I do, because when you begin to fight a fight and you fight that fight for a long time, and as I told you, I've been fighting since 1997. And I thought that I was in it all alone. So for it to come to 2018 and to realize that there are parents out there who are fighting to get the things done that I was able to get done, what I thought was alone, it just shows a lot of strength. And a lot of parent involvement. So that's why I am definitely involved with Parents for Healthy Homes.
Just a little bit of background too. What had happened over the years since Tasha's, it was your son, right? If I remember right. Yeah.
Yes.
Was exposed. Was that, lead levels in our local community did come down. We made some progress, and as that progress was made, there were decisions made about what were priorities in public health, and lead became deprioritized over time as the problem appeared to be going away. We still knew that in certain communities, and in many communities, but certain communities in particular, still a high number of kids being affected. As as Chantel talked about, her with the high lead level didn't have the same opportunities as Tasha's children because the public health department stopped doing what they had been doing previously. So I don't want to put either one of you necessarily on the spot, but so we rallied a campaign last year, and last spring we went and talked to county commissioners. One of you want to speak to that event?
That was a nice event. It was I think that was my first time going out to Lansing with you guys and actually speaking in public. It was a little different for me because I was like put on the spot for like interviews and stuff with some of the reporters. But even though it was like, oh man, I'm on the spot, it was like, oh man, I'm on the spot, but oh man, I gotta do this right now because I gotta speak up because this is the time, you know what I mean? So it was like, utilize that platform and that time to speak up and let the officials know what we're out here suffering with, what we're doing on our part, and how we're trying to help them make it better for everyone in the community. So it was a great experience for me in that, because sometimes you get into a mode just as a citizen where you feel like sometimes like your officials aren't listening, or how do I make headway with them, or how do we get some change in place and stuff like that. So me being in Parents for Healthy Homes kind of helped me get along in that process, more so of not so being more upset with our officials or anything like that, but trying to more so see where their head are. I'm learning more so now, like that I've got into it more, kind of what they're facing and some of the issues that they have going on, in addition to the stuff that we have going on too. So it's just, to me, I feel like it's like a parent who's got thousands of kids. You got all these people asking you, I need this, I need that, I need this, and you're trying to accommodate everyone. You know what I mean? So I enjoyed going out there to Lansing and speaking up for our families out here. I was asked to sit on one of the parents' board, which I was really looking forward to, but when the COVID-19 thing hit, that kind of put everything at a standstill. So I like it a lot being there, because then that lets me know what's going on for my own betterment, for information, for my understanding of how our group needs to communicate and move in order to try to get some progress as far as what we're trying to accomplish with Parents for Healthy Homes.
Mm-hmm. Tasha, did you want to speak to the, I'm thinking specifically when I really got to know you was when we were at the county building.
Yes.
You told your story. We have a great picture of you there with the county commissioner. You want to speak a little bit about that interaction with them?
Yes, when we won. Yes, when at that point, well, that was one of the highlights of being involved with Parents for Healthy Homes. Was we had been fighting the fight to get another sanitarian added, and we actually, is that what we're speaking to, Paul? Okay. And when we went there, I want to say since I got involved with Parents for Healthy Homes in the end of 2018, we have been fighting that. We were fighting that fight to get a sanitarian. So it was actually started before I came aboard. And when the day, I remember it, the day that we went before the board and they had to vote. And each of us gave our story, our personal story of why we felt that another sanitarian should be added. And the story that I gave to them was the same one that I gave about my son, is that I don't understand how they can do it for Trayvon in 1997. And here we are in 2019, and there are 1,000 Trayvons, and we're not doing it for them. And for when they vote, and when they voted yes, and yet, you know, it was just at that point and once again, emotional. It was a very emotional moment. And every time I think about it, it is, because once again, we stepped out there. We continue to fight every day. We fight a fight that some parents are not strong enough to do. And we stand up for those who are not strong enough. And we got it done. And this is something that's not easy for us. And we refuse to give up. So that moment, it is a very emotional moment and a very highlight of when parent involvement happens, and when we come together and we have our mindset to protect our babies and to get things done, and we don't give up and we won't give up, we will get things done.
Absolutely. And so the some of the things that Becca talked about in the beginning, the policies for being set up by the commission, and we have state laws that say that landlords can be held accountable. But our problem in Kent County was we didn't have sanitarians to go into the house to collect the evidence to hold these landlords accountable. And so Tasha, Chantal, and the parents for Healthy Homes made sure that they were present at that county commission meeting to say, you need to spend a little bit of money here. You got a big rainy day fund here, Kent County. It's raining. We need a little help in this area. Hire another staff person that can go in the house, get these investigations going, and use the laws that are already on the books and get to implementation. So thanks for sharing your stories. I'm looking at time and they've got some questions, so we're going to hop over to the questions now.
Yes, thank you so much, Paul, for keeping us moving forward. And Tasha and Chantal, thank you so much for joining us tonight. We've had a lot of great questions coming in, so hopefully we can get through them all. For starters, kicking it off with some questions related to water. The first question that came through is, have there been a lot of pre-1988 water coolers found to be still in use at schools here in Michigan?
I don't have data on how many of those still exist. They are supposed to have been removed. There's, a lot of these things that were supposed to happen. So I like to keep them on the list so we can be aware of them if we find them, but I don't have any current data on
that. All right. And Elin, this is kind of another question pertaining to water. What are the plans or thoughts for water testing as schools open in the fall of 2020?
So, well, there are no current requirements for testing. So any testing that would happen would be purely voluntary. It is going to be very important for schools to flush their pipes because, as I said, when the water is stagnant in the school pipes, that we've got lead, but we also have bacterial growth, which is also a big issue. So there are a lot of questions about what's going to happen for drinking water in schools if we open up buildings in the fall, because I keep hearing that it's still an if, not a when. So making sure that there's a lot of flushing prior to getting kids back in the building, but I know there's also just a lot of concerns about kids probably not doing any drinking fountains, putting their own hand in their mouth on the fountain. Bringing your own bottles is probably going to be part of going to school when we get back. So lots of questions and no requirements.
All right, so another question kind of related to COVID. Is there additional home testing since many children are in their primary residence during the Corona vacation?
So, well, is that for everything or just water?
That's for the whole panel, if anyone has any insights pertaining to home testing.
I'll speak to that just briefly. I mean, what's happened here is it's harm reduction. And I think what happened is in the eyes of the public and public health, the harm reduction around COVID kind of superseded harm reduction around lead. I don't personally happen to agree with that stance. So, you know, we ended up doing physical distancing. And so a lot of things like home visiting stopped. I can tell you that well, with the state's program and then in some of your larger areas, there was still home visiting for children that had exceedingly high levels of lead and moving forward on interventions for those kids. That's a reaction intervention. For kids that had levels like Chantel's child had, they've kind of put that on hold for the time being. We need to get back to that now that risk and harm around COVID-19 is reducing and we know how to take precaution. And then as far as primary prevention goes, right, that's out the window right now because we're more worried about the pandemic than we are lead.
So another question pertaining to testing, this has to do specifically with testing children for lead. Is it standard practice to test all children for lead, or do parents and guardians have to advocate for their children to be tested?
I'm curious, Chantel, what your experience was. Did you have to advocate for your kid, or did you get tested? Matter of fact, by your
Well, the way mine happened was my daughter got tested at the WIC office during her appointment. They do those routinely at every WIC appointment when you come in. And that's how my daughter ended up getting tested. And then once I got that information from them, they referred the information over to my doctor's office. And then my doctor, we scheduled an appointment with her actual PCP and had them go in and do a venous test, because at the WIC office, they only do the prick test for you. So they did a blood draw on her at the doctor's office to get her accurate levels. But I called today because we had a meeting for our Parents for Healthy Homes just before this one with baby scholars. And I reached out to the pediatric office that my doctor goes to, and that my child goes to. And they had advised me that they test between the ages of 15 to 18 months regularly. But if the kids don't show any level above that 5, then they don't do any further testing after that. So like I was telling people, if you move into a home after your child passes that 18-month period, you still can request your doctor to do that test on your child.
In some counties, WIC clinics do universally test the children that come through or make it available. Of course, parent can decline. It's kind of like vaccinations. But that's not in all counties. So and that's part of the commission's work, is to try to press for more universal testing, because we know we're missing kids. You're not on WIC, you're not going to be getting tested as readily as kids on WIC are.
Right.
Yeah, so you're relying upon your primary care physician to catch it, and our evidence of success rate there is it's kind of shaky. It's certainly not universally screened for in all practices.
Yeah, and that's one of the things in our group for Parents for Healthy Homes that we question a lot of the time too for our families in the community, because like Paul said, a lot of people in the community, they don't get WIC. You know what I mean? So for those people who don't get WIC, you know, how do they get that testing? You know what I mean? Just and even if they don't know that that's the testing that they can get, you know, how do we inform them and educate them in regards to letting them know that this is a test that's available that you can get under your insurance as well too.
Somebody in the comments said parents need to advocate, and that's absolutely true. If parents are advocating, it'll get done.
Yep, that's one of the things we like to also let be known too, because we're in the thick of things, you know what I mean? And a lot of time when people want things to change, you have to actually go to where the problem is. And the people are the ones who are suffering with the problem. So we at Parents for Healthy Homes know that we need to actually listen to the people within our community and see what challenges they're facing in the homes that they're living in that have been tested positive for lead and things like that. Some of the obstacles that they're going through with their landlords, or obstacles that they're having trying to get resources to just maintain while they're on lockdown right now, just to be safe. You know what I mean? So that is one of our big worries as parents for Healthy Homes as of right now during COVID-19, because these babies are locked in the houses now, and the houses aren't safe.
Mm-hmm.
So that actually brings me to another question that popped up in the feed, and it has to do with the fact that we have a lot of health professionals on the line tonight. So what is it as health professionals that can be done to help support their patients and families that have been impacted by lead?
I think that having health professionals advocate alongside the parents is really important. And I think things have been sort of thrown. We're going to have to figure out new ways to do that through Ecology Center, through Mission Alliance for Lead Safe Homes and other partners. I think a lot will go online while we can't be in person with lawmakers, but they're starting to go back into session in Lansing. And so what we're thinking about is ways to bring everyone's voices together, because I think that's a strong alliance. If you've got your doctors and your nurses and your parents standing together, talking to a lawmaker about how important this is for kids, you've got the personal stories from the parents and you've got the health professionals there. The other thing to do is, if you are practicing, make sure that you are routinely testing every child that comes into your practice. That doesn't always happen all the time. So ask if the pediatricians that are in a practice around you, if you're not a pediatrician, are they doing it? Ask, your own pediatricians to make sure they are.
Yeah, I'd second exactly what Rebecca said. And one story from our experience, one of the challenges right now is the American Academy of Pediatrics still wants to point pediatricians back to asking screening questions and then testing kids if they answer yes to the questions. That's a little bit challenging. We really believe there's a good reason to collect blood samples from all children so that we really know the depth of this problem, have solid evidence, not some kind of chameleon sample, which is what we work with right now. Physician, pediatrician in our community, Dr. Susan Wakefield at Forest Hills Pediatrics, she looked at her population, which is about 20% Medicaid and 80% non-Medicaid patients, commercial pay. Medicaid pays for the test, some commercial pay didn't. And when she ran the numbers and said, if I buy a lead care machine and just get a finger prick on every kid and run it through the machine, and we don't spend time asking questions, we don't fuss with paper and questionnaires, we just do it. How much does it cost me? And what she found out was, in her practice, it was more efficient, more cost effective to test every kid than it was to take the time to ask the questions and to figure out which kid needed to be tested and which one didn't. So I think we really got to look at our practice and figure out how can we make it work.
All right, so a couple more questions still coming in, trying to hopefully get through all of them. Elin, we have a clarifying question regarding the new lead and copper rule bans and the banning the practice of partial lead service line replacement. Does that mean that the city would be responsible for replacing the lead service line to the home, or would this be at a cost to the owner of the home?
Right, the water utility is responsible for replacing the entire lead service line, and they cannot charge the individual homeowner for the cost of that lead service line replacement. Because that's been a big problem in the past, that if you wanted the whole thing replaced, you had to be able to pay for the private side replacement, and it has huge environmental justice implications. So that's a huge improvement in the new rule.
We've also had a couple questions come through regarding testing of homes. So this has to do with testing like lead paint and soil, but also pertaining to water. Folks are just wondering, how do they go about getting their own homes tested?
So testing homes is a fairly expensive proposition, fortunately, because it is it's regulated. And this is an area where we don't want to mess around and do a shoddy job. And so that regulation is warranted, but it does make it costly. There are certified firms across the state that can test homes for lead. One of the things that drives up the cost is if they test a home, they test the whole home. They're going to look at every painted surface from the top of the roof down to the bottom of the basement floor. And they're going to test every surface and deem whether or not that paint is in a hazardous condition. And I'm talking specifically paint here, paint and soil. That protocol does not typically include water. That's going to be a separate test. And so because it's very labor intensive, costs range quite a bit. I'd be, let's just go really wide here and say $500 to $1,000 to get a home assessed for lead. I don't know where it is post-pandemic here as we come out of the pandemic, because those folks haven't been working for a while. So.
I'll answer about water. You can ask your water, if you are on a public water system, I would always start with the water system because many of them will sample your water for free. They won't always. One thing that's important when you are getting your water sampled is to make sure that you're paying attention to what sampling protocol that they're using. So making sure that they're using the 1 liter sample bottles. If you know you have a lead service line or if you have an unknown service line, at a minimum doing that 1st and 5th liter sampling protocol like we have in the Michigan Lead and Copper Rule. Oftentimes, and one thing that happened a lot last summer, is a lot of water systems, they went out and did follow-up testing with a 250 or a 125 milliliter sample bottle. So if you look at them, it's not representing much of the water. You'd only be measuring if your faucet had lead in it. So you're not getting the picture you need of the lead in your house. So making sure you're paying attention. If you go, sometimes health departments are doing this testing. Sometimes it's the water departments. That's where I would start, but really pay attention to what kind of a sampling protocol you're getting.
I would just add one more thing, and I know we're running out of time, so sorry, it's the last one, but this is the season where a lot of people are gardening and they're thinking about what they're going to put into the soil, and a lot of us are home and have maybe a little bit more time to do so. You can send soil samples into MSU and their agricultural extension at the state level, and then there's a number of different nonprofits in different cities that will help you, that will test your soil. So it just really depends on where you live, but that's another thing to consider because lead can be taken up by some of the plants, or you can have exposure when you track soil into the home or things like that. And there's different safer ways to garden if you do happen to have lead in the soil.
Great, thank you everyone. And one last question, how are advocacy efforts being coordinated for the multiple toxic challenges in water quality? For example, PFAS, lead, dioxane. Are there separate efforts or are there any more unified approaches being taken?
Well, I'll do a little bit of that. We at Ecology Center are trying to make sure we're unifying the approaches. We work on all of those issues. And so one of the things is you're probably, if you are in our fellowship program, you're certainly going to hear from Mara about efforts to educate incoming candidates running for the Michigan legislature about PFAS in drinking water, lead in water, but in other sources as well. And so that's one of the things that we're doing, and then looking at what other contamination is out there. There are other coalitions and efforts that maybe go chemical by chemical, and we want to try to bring everything together because we have to make sure our water is safe to drink.
All right, and with that, I just want to take a moment to thank all of our speakers tonight. We really appreciate you taking the time. Thank you again to all of our attendees as well. A couple quick logistical things before we wrap up tonight. I just chatted out our webinar survey evaluation. This is required for all Health Leaders Fellows, but we also really appreciate feedback from other attendees. It helps us plan our future events. Other quick things, the next fellowship event will be taking place next Wednesday. It's Media Training Part 1. We'll be joined by presenter Sam Inglot from Progress Michigan. I will also be chatting out that link into the chat box as well. And if you are not a Health Leaders Fellow, we also have one more event that will be taking place in our toxic chemicals and health webinar series, our Eat Safe Fish webinar that will be taking place at the end of the month. We'll be joined by Carolyn Koch from the Michigan Department of Health and Human Services for an overview on their Eat Safe Fish program. And with that, I just want to take a moment again to thank you all for joining us, and thanks again for our presenters for taking the time this evening and spending it with all of us. And thanks again, everyone. Take care, be well, and stay safe.
Thank you.